Greetings to the ZTV viewers. I am Dr. Sudhakar John Alagada, President, American Association of Physicians of Indian Origin. I am sure you all learned a lot in our previous community outreach programs on lung cancer and heart diseases in men and men's health. I am sure you learned a lot. Today, we're going to learn on heart diseases in women. It's very, very important to know, to understand. We have very exciting faculty. My privilege to introduce today's moderator, Dr. Sujit Poonam. He is an interventional cardiologist from Stockton, California. He is a global leader in prevention of sudden cardiac deaths. He is also serving a regional director for AAPI this year. Please welcome Dr. Poonam.
Hi folks, welcome to AAPI Community Outreach Program, Heart Disease in Women. As you all know, February is the Heart Month, and to commemorate that, AAPI is bringing you this program. And to talk to me today, we have two eminent cardiologists, Dr. Lakshmi Mehta, who is the Sarah Ross Sauter Endowed Chair on Women's Cardiovascular Health at Ohio State University, and also she's a professor of medicine. And I have Dr. Manpreet Basra, who is a non-invasive cardiology director at St. Joseph Medical Center in Stockton, California. As you all know, number one disease, the number one cause of death in women is the heart disease. But a little known statistic is 1 in 4 women die from a heart disease. And to answer a lot of questions that the viewers might have, I will take you on to the program. To begin with, I'd like to invite Dr. Lakshmi Mehta. Dr. Mehta, welcome to the show.
Thank you for having me.
So, what is the leading cause of death in women?
Sure. So the leading cause of death in women is cardiovascular disease, and that's globally. And when we talk about cardiovascular disease, we mean diseases of the heart, as well, such as heart blockages, heart failure, strokes, even issues with the heart valves. But many people think that cancer is going to kill them, and it's not the case. We know that 1 in 3 women will develop some form of cardiovascular disease in their lifetime, and 1 in 4 will die from cardiovascular disease. So it's important to remember that cardiovascular disease is not a man's disease. Women can suffer from it too and can die from it.
Are women different than men in terms of having heart disease?
Men and women can have different types of heart disease. So when we talk about coronary artery disease, the types of blockages that can occur in the heart arteries, they can be different in terms of how the blockage occurs, the length of the blockage, whether it's the small vessels or the large vessels. And women tend to have small vessel blockages, but can still have the large vessels. We also talk about heart valve disease or narrowing of the heart valves. And women, as we get older, tend to have aortic valve disease, probably related to us just living longer than men. But that's one difference. Another difference is heart failure, where how the heart kind of squeezes. So we often think of heart failure as being a weakening of the heart, and we see that more often in men than in women, and that's typically due to weakness from heart attacks. But women can have stiffening of the heart. It's much harder to treat and much harder for us to control. Another type of heart disease that's different is called atrial fibrillation, which is an abnormal rhythm of the heart. And when people are younger, it's more often in men, but as we get older, it's more often seen in women. The problem is that women are often undertreated for it in terms of needing the necessary kind of medications to help prevent strokes, which is a devastating effect of atrial fibrillation. Additionally, we talk about aneurysms, which are outpouchings of the blood vessels. And we see that men can have it more often, but women are often undertreated for it. And if they should get an aneurysm, they're more likely to die from it than a man. Another important thing is of cardiovascular disease is strokes. And strokes are devastating for both men and women. And I'd like to say that we need to remember the signs to spot a stroke, and that is fast. If there's facial drooping, if there's arm weakness, speech difficulty, it's important to call 911 immediately. And I think that people often neglect stroke, but that's an important thing to look out for.
That's important to know, actually. So what are the common preconditions that predispose to having a heart attack in women compared to men?
Yeah, there's lots of different causes or risk factors, I would say, for heart disease in women. High blood pressure is a very common one. And as we get older, our risks for high blood pressure increase. And so we need to manage it appropriately, as well as smoking is a risk factor for men and women. Fortunately, less women smoke, so that's good. But I would say that, the alternative e-cigarettes or other types of tobacco products are also a no-no and a risk factor for women. High cholesterol is another risk factor that's silent, that women don't know they have it until they get tested for it. Women tend to shy away from the medications that are necessary to treat it, so that ends up becoming more problematic. Diabetes is a risk factor for men and women, but women who have diabetes fare far worse in development of heart disease than men. So we should not neglect treating the diabetes and in stressing the importance of its relation to the heart. Obesity is also a risk factor. Women tend to put on more weight after pregnancy, and so that becomes problematic for them. Poor diet and exercise. In the Indian community, diet can really vary, and it's a lot of high carbs, and that is related to heart disease as well. And the lack of exercise. And it's not something that many people grow up with as a normal thing to be doing on a daily basis, but we really need to incorporate our community to do that. And it starts with the women making it part of their pattern of life. Sleep deprivation is also a risk factor for cardiovascular disease and can sometimes be related to development of high blood pressure and obesity. And so that's why it needs to be kept under check. And then air pollution is also problematic. And so depends on if you're out and about or in areas that have higher air pollution. But I do want to break and say that one of the things that can help is CPR, and women are often treated with CPR when they have a cardiac arrest. So I would like to say that it's important for everyone to learn CPR. It's hands only nowadays, and it saves lives. So it's pretty quick and easy to learn, so make sure you learn it.
So the risk factors are pretty much the same when it comes to men and women, but some of the risk factors tend to affect women in a little bit more dangerous form. And also the fact that the perception is what needs to be cleared in this setting. It looks like the men are the only ones that is having heart attacks is the perception. So that's what we need to dispel. Is that correct?
Yeah, we do need to dispel that women can have heart disease, and these risk factors are similar, but women are undertreated. The other issue that women struggle with is pregnancy-related issues can actually portend a future prognosis or problem for these women. So if a female has high blood pressure during pregnancy or diabetes during pregnancy, or preeclampsia, or even preterm labor, delivering a child before 37 weeks, that can increase the risk of cardiovascular disease or heart disease, meaning heart failure, heart attacks, and strokes or high blood pressure 10, 20 years down the line. So these are things that are happening in pregnancy that we should not neglect. The other thing to remember is as women suffer from psychological disorders like depression and anxiety, which can increase the risk of cardiovascular disease. And also, menopause ends up becoming a problem for women. So we often think that women are protected prior to menopause, but after menopause, our blood pressures and cholesterols can really vary and increase our risks for developing cardiovascular disease.
Wow. So there are certain risk factors that are unique to women then. Okay, good. So with that, we'll take a break. But after the break, we'll come back more with questions on, can women have heart attacks without having blockages? So please stay tuned. So with that break, let me bring in Dr. Basra. Welcome, Dr. Basra.
Thank you for having me. It's a pleasure.
So what is the current status of hormone replacement in postmenopausal women in relation to cardiovascular disease burden?
We usually think that, or it has been a myth forever, that giving people hormones after they reach the menopause is supposed to be protective towards preventing a heart attack. It's actually quite opposite to that. If you look at the various governing bodies that we usually follow, which kind of guide us for the treatment of various heart problems. American College of Cardiology, American College of Gynecology, National Menopause Societies. None of these governing bodies recommend that the hormones be used for prevention or treatment disease in women. So we do not recommend hormonal therapy for prevention or treatment of heart disease in women. There have been studies which show that hormones can actually be deleterious towards women's health, especially with development of cancer of various kinds. That being said, doesn't mean that there are certain sect of women who would not benefit from hormone replacement therapy. Of course, it is recommended for women who are having severe menopausal symptoms. They can be given, but we got to remember it is not for the prevention of heart disease. It is not for treatment of heart disease postmenopausal women.
So that means there used to be kind of a blanket, kind of a supplemental therapy in the past, and looks like after women's heart health study, we came to know that's not for everybody, and it has to be tailored. Okay, that's good to know. Now, can heart attacks happen in women without blockages in the heart circulation?
Yes, absolutely. So the major heart attacks that we all know about come from the heart arteries that supply the heart muscle that we look at through various imaging modalities like CT scan or cardiac catheterization. Those are called epicardial coronary arteries, or the arteries that go on top of the heart. But there is a certain kind of arteries that go inside the heart muscles. These are very small in size and constitute the microvasculature of heart muscle. So if there's any blockages in those arteries, it can cause heart attacks. Women are very prone to having spasm in the major arteries of the heart as well. So that can contribute towards a heart attack in women as well. There are certain factors that contribute towards development of coronary vasospasm, which could be, as Dr. Mehta said, psychological stress, inability to take care of the risk factors. Diabetes by itself predisposes women to developing the blockages in these small arteries of the heart. So yes, the microvascular related heart attack as well as the spasm related heart attacks are very commonly seen in women as well.
So do women have to be having regular checkups for preventing heart disease similar to men?
Absolutely. One thing that we have to remember is to be able to take care of our families, we have to take care of ourselves first. And all my friends and family, and especially my patients, I tell them to go for regular checkups, which include their yearly blood pressure check, cholesterol check, there's check for prediabetes, diabetes, making sure that their BMI stays below 25, they're going in for regular exercise, and keeping some sort of things to be checked on the loop so that nothing gets missed, because prevention is the key to prevent development of any major blockages in the arteries of the heart, to prevent development of heart failure. So these are very modifiable things we can do, which is to control our blood pressure, our cholesterol, our diabetes, and keep our weights under check. And take care of yourselves first before you take care of the rest of the family. A happy and a healthy you will keep everyone around you healthy too.
Yeah, like they say, prevention, an ounce of prevention is worth more than a pound of cure. And we
Absolutely.
all know that 80% of these heart diseases or heart-related mortality can be prevented with appropriate risk factor control. So are there any particular group of women that should not get pregnant because of increased risk of heart disease?
Absolutely. So, any woman who has cardiomyopathy or heart failure during her pregnancy should be very cautious and not get pregnant, because they have 50% higher risk of having cardiomyopathy the second time around. Any woman who has history of congenital heart defects, who has had surgeries, should consider meeting a high-risk pregnancy expert before even contemplating pregnancy. Any woman with history of tightened heart valves requiring correction as a child or as a young adult should consider once again seeing a high-risk pregnancy expert before considering her options. So these valves are the four gateways inside the heart that direct the blood into the various chambers of the heart. So any of these valves being tightened is a contraindication to pregnancy. Any woman who has history of increased pressures on the right side of the heart, for which we use the term pulmonary hypertension, should be very cautious in trying to conceive, and once again should see a high-risk pregnancy expert before contemplating getting pregnant. In the end, I would say pregnancy is basically contraindicated in anybody who has history of heart failure and congenital heart defects. Every other woman with any heart issues should meet the high-risk pregnancy expert, discuss her options with them, and reach a conclusion which both the parties are agreeable to, which is medically more relevant to the mother as well as her family.
Thank you, Dr. Basra, for that. And for my next question, I would like to invite Dr. Mehta again. Dr. Mehta, we hear a lot about coronary calcium scores, and we've talked about prevention, the role of prevention in heart disease, how we can control the risk factors and all. Can you enlighten us a little bit on what these coronary calcium scores are and what is its role in detecting or diagnosing heart conditions? So
coronary calcification is calcium buildup in the coronary arteries, or arteries that supply blood flow to the heart muscle. And it ends up stiffening the heart arteries, called atherosclerosis. So it's the early stages of plaque buildup. And this calcification can be seen on different tests of the heart, but the more specific one is the CT scan, so the coronary artery calcification test. And that is a screening test. And if a person has calcification in their heart arteries, we can use that to help predict their risk of developing cardiovascular disease, heart attacks or strokes, in the next 5 to 10 years. And so as a screening tool, we'll use it for patients who are at higher risk of heart disease or have an early family history of heart disease, or are on the borderline of whether to put on a medication or not. And if they do have coronary artery calcification, we do promote the usage of statins, which are cholesterol-lowering medications. I do want to stop and say that if someone does not have calcification in their heart arteries, it doesn't mean they're free from heart disease. It just means that they don't have the calcified plaque. So it's a great screening tool for the right person, and so I would suggest you talk to your physician about if it's the right test for you.
Thank you, Dr. Mehta. Again, I would like to thank both the panelists today, Dr. Mehta and Dr. Basra. And for the next month, our AAPI community outreach program, the topic is stroke prevention, diagnosis, and newer treatment options. And also, as a passing comment, I would like to bring in a news that we received recently, that our AAPI president, Dr. Sudhakar Jonalagada, has been awarded the Pravasi Bharatiya Samman Award, which is the highest civilian award given to overseas Indian citizen by Indian government. So congratulations, Dr. Jonalagada. And we would welcome you to join us for our next month's program. Thank you all for joining.